Prescription or a bitter pill healthcare reform passing in the House this weekend.
But what's in store for the measure once it hits the Senate floor? Joining us now with his take, Utah Republican Senator Orrin Hatch. Welcome aboard, Senator. Everybody talks about how there's a real opportunity here to make what was passed in the House better, to formulate it into something that could then be more palatable to more Americans. Do you see it that way at all, or are you just going to say no way to this thing?
Well, it's such a lousy bill in the House. For instance, they've now figured if you take away the budgetary gimmicks, that bill will cost $3 trillion. Now, the bill over in the Senate is probably going to be at least there's going to be at least $2.4 trillion. And one reason they have a budget, they can get it down to a little over $1 trillion, is that they basically don't count the first 3 or 4 years. They start the taxes in those years, but they don't count the spending in those years. So if you extrapolate it out for a full 10 years, the House bill will cost somewhere around $3 trillion, at the least $2.4 trillion, and the Senate bill itself is going to be up around the same.
Now, Harry Reid is going to have trouble getting a majority, or the supermajority. He needs to stop a filibuster. But there were 39 House Democrats that refused to sign off on this bill. Are there likely to be some Democratic senators who will go against Harry Reid and vote against the Senate version of this bill?
Well, nobody knows what Harry Reid's bill is, but keep in mind, if you look at the House bill, the only thing bipartisan about health care is the opposition. You know, you got 39 Democrats plus virtually every Republican except one. So that's the bipartisan nature. And the Senate, it's a little more difficult because the Senate is much more left, but there are 3 or 4, maybe even a few more Democrats who have to be alarmed about this. Just think about Washington, D.C. rationing. You know, just look at the H1N1. While seniors and children and some pregnant women have not been able to get their flu shots, they're appalled to find that the prisoners at Guantanamo are getting flu shots. And, you know, this is the kind of thing that just bugs people, and that's the determination made by Washington. That bothers me a great deal, too.
Senator, you call the House bill a lousy bill, but yet look at the status quo. Look at what's happened with insurance companies and small businesses. Just over the past 8 years, insurance premiums for small businesses, single policies, jumping 74% over just the past 8 years. Do you not agree that absolutely something has to be done, that left to their own devices, insurance companies are continuing to really stick it to small businesses?
Well, all Republicans and every Democrat believe that we should have some changes, some health care reform. But if you think that you're going to save money with these Democrat bills, already the Congressional Budget Office has said that premiums will go up under a government plan. In other words, it will cost you more for your insurance through a government plan than it will through the private health insurance. By the way, the private health insurers last year had about a 2.2% profit margin. Compare that with almost any other business in America, and you'll see that there's something wrong, but we've got to make sure we try and straighten it out.
Honestly,
it
though,
isn't because they're gouging.
But, Senator, we can't cry for the private insurance companies. We've seen what they're paying their executives, and it's millions and millions of dollars, so somebody's making a profit there. But putting that aside, you just talked about jumping forward to what the government plan would do. Is there not a solution? What do the Republicans have that would ameliorate this situation?
Well, first of all, I don't think the insurers are doing a great job by any stretch of the imagination, and we need to make some changes there, no question. But if we had the Republicans in control, we would first emphasize the states. Number one, we know that we have 50 state laboratories where we could have them work with federal government funds to establish what they need for their own demographics. Utah's not New York or Massachusetts or New Jersey, neither are they Utah. But they have their own special demographic needs, and we would be able to work on that. Secondly, we would attack medical liability reform to save the hundreds of billions of dollars over the years that go through unnecessary defensive medicine. Thirdly, we'd make it more transparent so people know what kind of health care they're getting. Fourthly, I mean, we could go through a whole raft of things that Republicans would like to do. We have 6 Republican bills. The problem is we only have 40 Republican votes in the Senate, and there's no question that there isn't anything we bring up that is going to pass as a bill. So what we have to do is work to try and reform what is brought up, or at least defeat it if it isn't worthy and if it's just going to cost us an arm and a leg. I could go on what the Republican approach is, but you can bet your bottom dollar 85% of the people in this country have health care of their choice. Now, we're going to throw this whole system out for 85% of the people when we could take care of the other 15% through subsidies and other type of approaches that would help to resolve their problems.
Senator,
why would we do that? Why would we turn it over to the government?
I got to ask you one more question about the vote, because your fellow Republican Senator Judd Gregg was on Fox Business this morning. He said he sort of conceded defeat in the Senate. He said, quote, Obama wants this. He's got supermajorities in the House and the Senate, and you've got to presume that when you have supermajorities, you get what you want. Do you agree or disagree with your fellow senator?
Well, they have to pass something, the Democrats do, or they're going to look terrible in the Senate. But I don't think they can pass dogs like they've got currently in effect. The fact of the matter is that I believe it's going to have to be changed in the Senate to pass, and it's going to have to be changed drastically to pass, and you're going to need some Republican votes in order to do it. And right now, I don't see any Republican voting for what they're trying to do. You're talking about $500 billion out of Medicare at a time when Medicare is going to go bankrupt by 2017 and has a $38 trillion in unfunded liability. I mean, that's just stupid, but yet that's what they're going to do. And they do it on the basis that they're going to save, you know, on fraud, waste, and abuse. Now, come on, we've been saying that for years, and that never seems to happen.
We'd love to see the fraud, waste, and abuse out. But, Senator, thank you very much.
Senator Orrin Hatch from Utah, thank you, Senator. Appreciate it.
We should